Vamos a comenzar. Señor Cortés, ¿me puede hablar de su vida? ¿Cómo llegó a Estados Unidos? ¿Nació aquí? ¿O cómo fue su vida y después cómo estudió y cómo llegó a la clínica? Más o menos en ese orden.
So in inglés?
En inglés puede ser.
Okay, so in inglés, uh, 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 I was born here in the United States, in Texas.
Oh my goodness.
Yeah, I was born in El Paso, Texas, and my father worked for the government, and we moved around all over the country, all over the nation. Lived in various places around the United States. Years and years later, when I got married, my wife and I moved here to the Bay Area.
Pero su papá, ¿y usted es solamente hijo único?
No, tengo dos hermanos y una hermana.
Ah,
Yeah.
en Texas.
Well, viven en diferentes partes de los Estados
Claro.
Unidos.
No,
ahora.
al principio. Digo.
Yeah.
Ah. Continúe.
Well, so ¿qué es la cuestión? About your life and family. Sí, so I have two brothers and a sister, and we moved around the United States.
Wow.
Yeah, I'm not sure exactly what year, what to share.
Doesn't matter.
It's a complicated story.
Okay.
But I ended up in the Bay Area in the 80s, and when my wife and I got married, we ended up moving here.
That's good. And why did you move to California?
That's a part of a longer story, but at one point I was in the Navy, and as with people who are in the Navy, you're all over the world.
Oh, okay.
But one of the places where I was home based from was here from Oakland, from the Naval Hospital here in Oakland, which doesn't exist anymore. And so that's why we came here. But I only had a few months left, so that's why we moved here.
Okay. And how did you jump from being in the Navy to being the Clinica? Well,
that story is actually my wife's story.
Okay.
When we moved here, the story is that we needed a telephone in our home, in our apartment.
You didn't have it?
No, because we had just moved here.
Okay.
So we called the phone company, and someone came to install the phone. And the person who came to install the phone was a Latino. And my wife was speaking with him because I was at work and she was at home. And she asked him, where to find healthcare, where was the center of the Latino community in Oakland, and he said, "Oh, you need to go to La Clinica." So she told me when I got home, and I think it was a couple of days later we drove to Fruitvale and we found La Clinica. And so she's the one that ended up applying shortly thereafter, and she's the one that began working at La Clinica first, before me.
Yeah, and in what department was it?
She had a lot of different jobs.
She's the doctor, or?
No, she had a lot of different jobs, but she worked in those years it was a little bit different than it is today. But she worked as a medical assistant. She worked in medical records after that for quite a while.
Interesantísimo. And then?
Well, when I finished my time in the Navy, which was only between us moving here and that time, it was only a few months. They needed some help with computers. They had a few computers, but they didn't have anybody who knew how to take care of them or fix them or any of that stuff. So, to make a long story short, La Clinica made the decision to hire me on a contract. So I actually came here first as a contractor, and supported them for whatever they needed around computer technology at the time. But it was in those years it was very, very basic. There was only a few computers in the organization.
Yeah.
So these are I'm talking about the PCs that were connected to, that employees used. But by the time I got here, La Clinica had what's called a mini frame computer. A mini computer is really what they were called. It's a machine about the size of a small refrigerator. And that machine is what ran the business, really, for the organization.
Yeah.
They also kept a lot of the patient information in that machine. So that machine used a much older technology from the 70s, really from the 60s, to be able to have what they call dumb terminals all throughout the agency that people used to access whatever information they were looking for. So part of my job was also to take care of that machine and all of the connections and all of the systems that were connected to it.
It was like a maintenance.
Yeah.
Oh, that's nice. Okay. In who you contacted for the first time? How was your impression to come to the Clinica? What
Well,
do you think?
I already knew about La Clinica through my wife. So we already had a sense of what the mission was and what the goal was, and for me those things are very important to help the community, to help our own community, and to be a part of being able to provide that very critical medical care to our community, and especially to those who didn't have a way to access that kind of care anywhere else.
Mm-hmm. You have been working, and then you have stories. How was the people? How was the environment where you work? Where were your?
When I first came to La Clinica, it was just the few buildings that are on Fruitvale. Have you been there before? Yeah, so just the few buildings that were on Fruitvale. And when I first came to La Clinica in 1989, they had already merged with San Antonio. It's about 4 or 5 miles away, I think, in a different section of Oakland. And so there was that facility down over there for San Antonio that we also had to take care of. The systems, the computer systems in that building could also connect to this machine that existed back then.
Interessante. Okay. Can you share some milestone and challenge you encountered while establishing and expanding health program for La Clinica?
Well, at La Clinica, as a nonprofit, the issue has always been funding. Something we were talking about a few minutes ago for something else. Technology, even in those years, has always been expensive, and so looking for funding to be able to pay for the things that are needed has always been one of the biggest challenges. But it's a challenge, so to speak, that's behind the scenes. It's behind the scenes in terms of what needs to be done in order to be able to provide the health care to the community. That technology is really critical to being able to provide that health care in a way that gives some structure to the staff, so that they know where they can find whatever it is they need to find to be able to give that health care. I don't know if that makes any sense.
It makes it for today. It makes more sense, I guess, than the other time.
Yeah.
But I can see that you came and focused on what you have to do, how was the environment and your surrounded people? I talked to Señora Rosa Villalobos already, and how was it? All of this, you come with your mind that everything was set up. I had to wire this computer and do that, or what else?
No, I think when I came to La Clinica, I don't remember how many employees, but I don't think there was 100 employees yet.
Yeah.
I think it was very few. Today, I think there's close to 1,400 employees in the agency.
Uh-huh.
Back in those years, you got to know everyone, and you got to know their family, and you knew everyone. But everyone was here really because that they knew what they were doing was something important, something that really needed to be offered, so to speak, to the community. There was a lot of people that were here when I came to La Clinica that had been here from the beginning, and so.
Because some of those persons were.
Just in working in different jobs in the organization.
Yeah, but you know the name, like you work here when Hayes Bautista was here, or?
No, I probably arrived close to 18, 20 years after that. Yeah, I came to La Clinica in the late 80s. I think it was 1989 when I came to La Clinica.
1989.
Yeah, 1989. So by then a lot of the founding people were no longer here, but there was a lot of staff in La Clinica that had been here from the early years.
And how was your relationship with them? You're a social person, or you are?
Oh yeah, no. I mean, so the name of the department today is information technology, but information technology at La Clinica is much more than just computers, keyboards, and mice. It's a lot of other things. For example, we have a whole team here that handles just informatics. Plainly put, it's this ability to look at the data that belongs to the organization and put it together in ways that help staff do what they need to do in terms of their own jobs.
Okay. And let me see. How was the name of the department when you got here?
Well, there wasn't a department. It didn't exist.
Did it? Yeah.
That's what I'm saying. When I first arrived in 1989, they hired me as a consultant, really to help them.
Uh-huh.
A few years later, there had been an audit, and one of the things that came out of the audit was a recommendation that if there was going to be a department supporting technology for La Clinica, then La Clinica should probably do something about formalizing it. And so that led to a series of conversations, and eventually La Clinica decided we were going to start a computer department. That's what we called it back then.
Uh-huh.
I don't remember exactly when we changed the name from computer department to IT department, but that was really the genesis of it. It was probably by the early 90s when that department came together for the very first time.
Good.
We had to speak with everyone because there's always issues with these machines. So making sure that we spoke with everyone and then gave them training as the technology was changing, and
got to know. Connected with all the department of it.
Right. So constantly moving, talking with people, helping them. I see my role at La Clinica, and really I see the department's role at La Clinica very much as a, well, at least specifically for me, as a servant leader, which is this idea that we're here to support the staff, and the staff are here to support the mission, which is to take care of our patients, and to provide that health care to the community. So, we're very behind the scenes. We're not in front of the patients, and we're not really in the public eye, but we're here to take care of this very critical environment that keeps the organization running behind the scenes. So in order to do that, one of the things that's critical is serving every single employee, every single person that's working in the organization. So as I said today, I don't know that I know every single person, but certainly in 1989, I definitely knew who every single person was. And I would say today, out of the team that we have today, collectively, we know every single person in the organization as a team.
Yeah, as a team.
Yeah.
I like this name. It's public servant leader.
Servant leadership, yeah, it's one of my philosophies in life. It's this idea that servant leadership is really this idea that everything begins with this role of taking care of the individual. So for me, especially in my role, I always start with my staff. How are you doing today? Are you okay? Is there anything you need? That sort of thing. And once we have that base foundation that the persons that are working for you, the people that are working for you, are okay, they're healthy, their needs have been taken care of, then we can move to whatever the work is. And in that case, it's really the needs of the staff throughout the agency. And it's really the same thing, this idea that we're providing support for them, whatever it might be, fixing a mouse, solving some software problem, whatever it may be. But we're doing it from this position where we recognize that we're critical to helping them get their jobs done for the organization, and we need to be able to provide that support. So I always think of my role from that lens, servant leadership.
Yeah, no, it is a amazing philosophy. I wish all the public officials think about them like is all over the world, because I'm talking that there are people that think they are leader, but they are not servant of the people.
No.
And
No.
It's really, let's say, original.
Yeah, I think it's important, and even the order of the two words is important, because leadership is not the first word in that phrase. Servant is the first word.
Yeah.
And it's this idea that we're here to serve. And so in some small way, that concept of servant leadership is in many ways an unstated mission, I think, of the organization as well.
It's incredible. I really appreciate it and admire this way of portray all the management,
Yeah.
of the clinic. Really good. La Clínica de la Raza is a testament of the founder, unwavering resilience and determination that was established in the 70s, time of social change. What did you know about La Clínica de la Raza aligning with their broader social and political context? Like, did you get to know, to hear, it was time that you had to, I guess it was impossible not to know about the Black Panther movement and the social justice movement. And then what was your intake of this, or your relationship with those things?
We could probably talk about that for hours.
Okay.
There's a lot to say.
Yeah.
Certainly at some point at La Clinica, I became aware of its founding history, that it had been born from students from UC Berkeley who really had this vision of being able to provide healthcare to our community, to the community here in Oakland. And that mission, if you will, today, you can still find those words in the mission statement of the organization. In fact, I took a minute to write it down before this interview, so let me just read a little bit of this to you. But it says, improve the quality of life of the diverse communities we serve by providing culturally appropriate, high quality and accessible health care for all. And while maybe those words weren't exactly constructed that way at the very beginning in the 70s, it certainly was part of that vision for creating what became La Clinica. But honestly speaking, I think part of the reason why I say this is really a much longer conversation, it could take hours or even days, is that La Clinica really has always been a leader for many of these things, and there's many areas where we can talk about, La Clinica's role in many of these things. Perhaps you probably heard some of these already in some of the interviews that you've done. But La Clinica has really always been at the forefront of a lot of this. Yeah, I'm not sure if that's answering your question exactly, but.
You would say the La Clinica have a front role in what?
In leading what is positive for providing health care, and really not just in our own community, but I've seen La Clinica, be a voice, even in the state and in the nation sometimes. There was a period of time, and I'm sorry, I can't remember the exact group of years that this was, but there was a period of time where prenatal healthcare, for example, just prenatal healthcare in period, was something that needed to be fought for, and La Clinica was there on the front lines for that.
Does mean that there was a problem of authorization to have a prenatal care and everything?
I'm not sure I know the whole story exactly, but it's my understanding that I think the way I understand it is that at one point in history, funding for prenatal health care was either being taken away or it wasn't there. And so being able to advocate for prenatal health care, it's for our community, for our women, for our children, all of that, for families. But being able to be at the forefront of that fight, if you will, if you can call it that. Certainly La Clinica was part of that.
Yeah.
And it has been part of that sort of thing for many, many different things that have come back and forth over the years.
In La Clinica still have a relationship with the United Farm Worker people like Dolores Huerta, or
I don't know that we do. I don't know that we do directly, but I know that there are relationships, that are behind the scenes, certainly. But I don't know that there was anything direct at this point.
Okay. In that regard, in that same area, I guess you hear about the program of the Black Panther that have some meaning for you in that time, or some influence?
Honestly speaking, by the time I came to the Bay Area, a lot of that movement had passed in history. I think there probably was still some, what's the word? Let me switch to Spanish for a second. This thing that is part of the.
You say Spanish.
Yeah, it's part of the, and I'm sorry, I can't think of the exact word in English, so I'm going to say it in Spanish, but it's parte de la lucha, ¿verdad? So the Black Panthers were fighting for something. The United Farm Workers were fighting for something. Even the students who started La Clinica were fighting for something. This fight, this lucha, is rooted in many things. But one of those things, for example, is this idea of standing up against racial inequality, and all that brings to the table. One of the things, for example, that brings to the table is, if there is racial inequality, then how can there be accessible health care for everyone, even the poorest of the poor? And so, sure, while you're mentioning the Black Panthers and you're mentioning the United Farm Workers and some of these other organizations, yes, they may have moved on by the time I came to La Clinica, but that fight That fight exists today. It exists in many other forms. And La Clinica has always been at the forefront of fighting for health care for everyone.
And for quality of
Right.
life.
And that's why I wanted to read this mission statement for you, because sure, that, you know, while the Black Panthers were very active in the 70s and probably before, the United Farm Workers as well. Of course, the United Farm Workers still exist today. That fight is still there, just in different forms and in different ways, and maybe even to say that it has matured itself, the fight, to be able to fight it in different forms in different ways, but to keep advocating for healthcare for our communities. Does that make sense? I don't know if that makes any sense.
No, that is music to my ear.
Yeah.
Yeah.
And so I will tell you that, sure, while I come to work every single day and I worry about bits and bytes and wires and networking and cybersecurity and all the other things that I worry about, at the end of the day, and even during my work, I recognize that the work that I'm doing is really in support of providing that health care, which in and of itself is part of that fight.
Very well said. Here is the sixth question. At the beginning of your career, what the health issues were prevalent to the initiates of your career and the Latinx community? What do you see when you enter the clinic? It's true that you are not doctor, not related, but you know, the whole environment, the whole community, the press, the media at this time, you know, have issues like with epidemic like HIV, AIDS, or, you know, but before that, because I helped the Clínica de la Raza in this frame of fighting inequalities in health, you know, try to or put it in the positive, you know, is you know, provide the community with the Latinx community by that time with the care that was not only culturally appropriate, and I'm talking about the language, but concern about what was important for the community. One of the issues that always got is the mental health, you know, before the age and all the AIDS era, let's put it that way. But when you enter to the clinic, what was the first issues besides prenatal care or whatever that you can say?
You know, that's a good question. And in some ways it's a complicated answer, and in some ways it isn't.
Give me the complicated answer.
I think if I start with the other, we can get to the complicated, and the other is part of this goal is to provide health care to everyone. And in the entire mission statement, in the entire goal of the organization, there's no mention of how does it get paid for. Many of our community don't have the financial resources to purchase healthcare from any other venue that is possible today or even back then. So being able to provide healthcare in a way to the community, where consideration of payment is not part of the equation, is an important component of this whole thing. What is it I'm trying to tell you? What I'm trying to tell you is those students that started La Clinica, that was part of their goal, was to be able to just provide health care. It's to provide health care, period. Mm. That means that that members of the community who can't pay for it have a place to go to get health care without having to worry about that component of it. And that's what part of La Clinica's goal is to be able to do that for the community.
Let's put an example to
well, that's what I'm trying to get to. So,
okay.
So at the beginning, it's this I don't want to call it a solution exactly, but a solution, so to speak, to the problem of just getting the basic health care. And so what are those things? Well, of course it's medical. Of course it's dental. Of course it's optical. It's those basic things. Somewhere along the way, though, and prior to me arriving at La Clinica, there was recognition that we also needed to provide mental health services to the organizations. By the time I arrived at La Clinica, there already was a mental health component, even though it was small. There was a mental health component here at La Clinica. And in the years I've been here, I've watched it grow. And I like to think that I've tried to support that growth as time has gone on.
Good. I know that was inside the clinic, but in your surrounded when you come, and then what people were saying about the mental health of, because people were talking about the providing ophthalmological service, dental health service, and it's comprehensible. Many people, I think it's clear that the poor community need, beside the healthcare, dos specialists, dos departamentos especializados, ¿verdad? But mental health is something that no se ve mucho ni siquiera en las comunidades que pertenecen a países latinos. Mental health es como rezagado, pero for la clínica was at front. Es porque se veía mucha violencia o se hablaba de mucha violencia, violencia doméstica o violencia en las calles, o maybe drug issues.
I think it's all of that, actually. But another component is also about the way the state of California, on the political level, has thought of mental health services for the public in the state of California.
This is interesting, but
and you'll have to forgive me because it's a history I don't know. I don't know well, so I'm not sure I can speak, clearly and perfectly to this. But I know that as time has gone on, certainly from the 70s to today, the way mental health services or funding, I guess I should say, from the state has certainly changed, and as it's changed, it's left gaps. It's left gaps in the way that mental health care is provided really to the community. And La Clinica, quote unquote, as a safety net, has done its best to look to see what it can do to fill those gaps. And one of those, of course, is by being able to provide mental health services. So it's all of the things you just said. Yes, it's all of those things, because those are inherent in our communities.
Yeah.
And to not recognize it and to not call it out is really a mistake. To be aware of them, to discuss them, and to constantly look for solutions to those things is really quite important. But it's not the whole story. There's also things that are happening outside of that sphere, so to speak, that are having an impact on the way those services are or aren't provided in the state and even in the nation.
Yeah, absolutely.
Yeah, it's a history I don't know perfectly well. I'm aware of it at a high level. I suppose some research on the internet would give you a sense of how funding for mental health services in the state of California has changed over time, and overlaying that with what La Clinica has done along the years, I'm sure you will be able to see a correlation to La Clinica's response to providing that health care with respect to that political picture, so to speak.
Yeah, and then
and for the record, it's not just the state, right? It's all the other layers down below it. It's the state, it's the county, it's this, it's that. And there's a lot of consideration in that.
You know, it's something that is now we can say is global.
Mm-hmm.
You know, the madness that is happening in the world is crazy. But then you were here just from the beginning of the AIDS pandemic. Because it began like in the 80s.
I'll be honest with you. I think I became aware as a teenager that AIDS was in our community, probably in the early 80s.
What? How old was you?
When I came to La Clinica, I was in my early 20s. Don't quote me, but I think I was 21 or 22 when I got here. I can't remember.
You were a baby.
I was really young. Yes, we were both. My wife and I were both very young.
Wow.
But I think all of us were aware that AIDS was in our community in the early 80s.
Okay. And how the clinic, your department contribute to help to AIDS?
Oh, I think that's a question that's a little bit more difficult for the IT department, because our role really was to be able to provide this technology to the agency.
Yeah,
but La Clinica's response to sorry, some guy's pulling up over here. La Clinica's response to AIDS has always been upfront. I mean, we have and still take care of our patients. One of our doctors, a good friend of mine, Dr. Paul Baird, has been at the forefront of really taking care of our AIDS patients, at least here in the Alameda area, the Alameda County area.
Mm-hmm. And he's alive still?
Sure, he still works for La Clinica.
Oh.
Yeah.
Great.
Yeah, I think as with many other things, the response to provide care for AIDS and other things like that has been critical. COVID now, for example, is another area.
Yeah. Or H1N1.
Right.
That was an issue.
Right, and the variations that have happened since then.
I suppose because you give me the impression that you don't know all their facilities. Like.
Oh no, I know them all.
Oh.
Yeah, I know all of our facilities very well.
Yeah. This is another question. Facilities outside of the clinic.
Oh, other organizations.
Other organizations.
We've done a lot of work for, or I shouldn't say for, but with other organizations over all the years. So I know many of them. Do you know that La Clinica belongs to the Community Health Center network here in Alameda County? So CHCN?
No.
The CHCN is a group of 8 community health centers here in Alameda County. Another complicated story, but by the time I was coming to La Clinica, CHCN was just being formed. Mm-hmm. And so on the technology side, there's several of us who had a lot of conversation behind the scenes about, what could be done then, and certainly what could the future look like.
How one organization work in comparison with the other.
Well, I'll give you one example. So I came to La Clinica in 1989. I may have my years wrong, but I think it's in 2012. All of the CHCN health centers came together to purchase one electronic health record system. Back then, that system was called NextGen.
How what?
It was called NextGen, the EHR system. So EHR stands for Electronic Health Record. Mm-hmm. But that work to be able to have all the community health centers using one same system so that records could be shared between organizations, that wouldn't have been possible if CHCN hadn't been born back in that period of time. And so some of this conversation around technology, while sure it wasn't really the main focus of what CHCN is today, the conversation around technology is certainly one of those conversations that happened behind the scenes,
Mm-hmm.
and was supported. I remember I remember in the years before that, La Clinica shared its. Remember, I told you we had this very large computer back in the late '80s.
Like a small
Well, yeah, it's about a small size refrigerator. In the 1989 earthquake, it got damaged, and it took us weeks to find the parts and get this thing repaired and running again for the organization.
Yeah.
It was running a precursor to an electronic health record system called a practice management system.
Wow.
And the name of the product was Merit. It was a product from a company called Merit Software. So back then, we provided that system to all staff that needed it here at La Clinica.
Mm-hmm.
But in the very late, well, actually, I'm not quite sure I remember exactly. I'm going to have to go back and look at my notes on this. But at some point in time, there was a decision that was made with other health centers that were also part of CHCN to share space. By then, the large refrigerator server had been replaced by much smaller ones. It was still a server, and it was still doing all of that stuff. But as time went on and systems were faster and smaller, we were moving to those. But there was a decision made that we were going to host the software for other community health centers here in the Bay Area. And one of those was Tiburcio Vasquez, which at that time was the CEO was Joel Garcia, somebody you mentioned a little bit earlier. And I remember one of the very last things before he signed the contract for us to host Merit software for him, Joel asked for me to go and meet with him. I had known him before, but we had never really spoken. But he asked me very hard questions, and I was able to answer them all for him. And at the end of the conversation, probably an hour-long conversation, he got up from his desk and he came around and he shook my hand and he said, "I trust you. I know you're going to take care of us, and so I will have the contract signed by the end of the day," and he did.
Nice.
So to answer your earlier question, was I aware of other community health centers? Yes, I've been aware of many of them, not just even here in the Bay Area, but in California. Today, La Clinica is part of a number of different types of organizations like CHCN, and we certainly participate in all of those organizations and know all of the other member organizations and partner with them on whatever the endeavors are.
That's cool.
Today, the electronic health record system for La Clinica is no longer NextGen. We run a system called Epic. If you look that up on the internet, you'll find out it's one of the largest electronic health record software systems in the United States, maybe even in the world. We run our version from an organization called OCHIN, which is out of Oregon. And there are hundreds of organizations that are part of OCHIN, and we all participate together regularly on whatever the changes are, whatever it is we need to do to learn about whatever those changes are, for training for staff, and a great number of things related to that system. So in my job, while yes, I'm not exactly in front of a patient, I'm not a patient-facing kind of role, and neither is any of my staff, we certainly are participating in these forums to help provide whatever guidance we can or whatever learnings we need to learn and then pass on to the rest of the staff in the organization. In fact, some of the teams that you see out here, their whole purpose for existing in IT is to provide training and support for the electronic health system for staff in La Clinica, and they regularly communicate with OCHIN and certainly other organizations that are part of OCHIN for that.
Nice.
Yeah.
Nice. Then this is something. Can you share any personal stories or experience that vividly illustrate the profound and life-changing impact of the health service you work on individual families with Latinx communities?
On individual,
Okay, individualities with individual or with family. Like I know people had told me in several interviews that at the beginning you have a room for all purpose, and that you met with people and you talk with people, and then the meeting with the you know everyone, like you say, but everyone families too. And I don't want you to tell me things that are private for the family.
No.
just some kind of sort of anecdotic of something that you think it can be relevant for this research.
I think there's probably another area that could take hours and hours to talk about. There's quite a bit to say. I think with respect to information technology department here at La Clinica, and again in this concept of servant leadership, one of my goals has been to, and it's also part of the funding issue, right? We certainly can't pay the high salaries that technology in California can pay in other companies. So part of what I have seen or have wished for and tried to do with information technology is to give, in much the same way that we La Clinica provide healthcare to the underserved of our community, we also are able to do other kinds of things for our community. So one of the things that I've been able to do through information technology is give people a first chance to work in technology. Many of the employees here in IT, some even that are here today, would have never had a chance to go work at a Google or a Oracle or a IBM or a whatever. They would have just, their resume would never have been considered. But they're super intelligent people, and they just needed a first chance. And in many ways, working here in information technology, a lot of the people that have come through here have received their first chance. And some of them have left La Clinica and gone on to do amazing things with the rest of their careers. I'll tell you one, maybe two stories. Shortly after I arrived at La Clinica, it was clear I was needing some help. And I don't really remember the exact story around this young man, but every once in a while, I had a really tiny office in one of those buildings on Fruitvale, in the back of one of those buildings. And every once in a while, he'd come knocking on the door after school, and he'd ask me, do you need some help with this, or do you need some help with that, blah, blah, blah. And I'd say, we got to build these computers, or we got to program that, or whatever it was I had. And so I'd give him a little bit of training, and off he would go, and he'd get the thing done. I saw real intelligence in this young man, just brilliant intelligence. But coming from a family that was just as poor as can be, he didn't have the financial resources. And for him, this idea of going to college and getting a degree and getting into a high-paying job somewhere, it wasn't even on his radar. But over time, I had an opportunity to really communicate with him and give him a concept of what it was like to be able to apply somewhere and be considered and to go and finish your degree. Make a long story short, a couple of years later, I helped him apply. I think it was to UC Berkeley, as I recall. And he got accepted to the School of Engineering. He ended up getting his degree, and his life changed from that moment on. And that's the kind of story of the employees who have worked here at IT, not just then, but even today. I have employees that are like that. They just needed that first chance. And being able to find that and to look beyond whatever's on their little piece of paper, whatever their resume is, being able to find that and be able to give them that opportunity, give them some training, and have them help you do whatever those big things are from a technology perspective has really been part of my goal as the leader of IT here at La Clinic all these years.
Wow.
And if you talk to some of these staff over here, so they will tell you, yeah, I got my first chance here.
That's beautiful. Yeah.
It's important. I will tell you this. When I was growing up, so I'll tell you a tiny little story about me.
Mm-hmm.
So because because of the job my father had, we were moving around to a lot of different places.
He was military?
No, he worked for the federal government.
Okay.
But we were constantly having to move around the United States. And because of that, I went to many different schools. At one of the high schools that I went to, the year that I went to that high school, they started a computer club at the school. And of course I was very interested and I wanted to be part of that, but they wouldn't let me in. There was a teacher who was responsible for that club, and he saw me and another friend of mine who also was not allowed to participate in the club. You have long hair. No. I never really did.
Okay.
But the two of us, we weren't allowed to participate in this computer club. And one afternoon, this teacher finds us, and we explained to him that we understand enough about computers that we'd like to be part of it and learn some more and blah, blah, blah. He called us into his classroom, and he talked with us for a little while, and he said, "It's Friday. Take the weekend. I'm going to give each of you a math problem, and I want you to write a program for that and bring it to me on Monday." So he gave each of us a different math problem, and we had 2 days basically to write a computer program and then bring it to him. And if he thought whatever it was that we produced was adequate, I guess, in a way to say, he would let us join this club. Mm-hmm. So I went home. I wrote my program for my problem. My problem was to find the volume of a sphere. Wrote up the program, and my friend and I brought it to him on Monday morning, and he took a look at both programs, and he said, "These are perfect." So I'm going to tell these guys that they can let you into the club. And sure enough, that afternoon we were working on the 2 little computers that the school had just bought, and we were part of that club.
It was a challenge because it's kind of weird that the professor said that before.
Yeah. What I'm not telling you, and what I didn't know then, because I was just really a child, is that the reason that we weren't in the club or allowed to be in the club was due to racism. Here I am, a brown child in a school that's primarily Caucasian, and my friend, coming from Jewish roots, was also having those kinds of struggles. I didn't fully understand that at the age that I was. I do now as an adult. But the action that this teacher took stayed with me, and has stayed with me my entire life, and has really guided me in how I view what we're doing here today with information technology, and this idea of giving people a first chance to look a little deeper and see what they can do for you. Some of the guys that I have working for me here today are immensely intelligent. Yeah. I can't begin to tell you the level of intelligence in some of these people that work here today. In fact, in all of the staff that work here today. But if you were to look at their resumes when they first started, there's no way you could tell that they would be ready for this kind of work.
That happened.
Yep.
And that's a part what we wanted, if you let me. With the first generation Latinx student, and that you see them, and you know I know why some people close the door, they don't want to spend time, and that's why we wanted to go ahead and training them, give them some knowledge.
Yeah, one of the things that I'm most proud of for IT department is the diversity of people that we have working here. We have representation of various cultures and ethnicities, men and women, and it's been that way since the beginning, because I have intentionally recognized that sometimes someone just needs a first chance, which in some ways is a tiny little part of the mission of La Clinica. It's this idea that, yes, La Clinica is here to provide culturally appropriate healthcare to the underserved community of where we are. But it can be a little bit more than that, and some of it can be this idea of let's give people a chance if you can see a little bit below what they're able to show you on a piece of paper.
Yeah, great. You say 2 stories. What is the other one?
There's probably several. Yeah, I'm not remembering exactly. There's probably several. There have been a lot of stories like that. Yeah, there's probably been a lot of stories like that.
That's great.
Yeah.
Let me see. Well, you already almost answered this question about how do you programs support adaptability, unwavering commitment to meeting. I am the number 9 question.
How has the health program where you work evolved, showcasing its ability and unwavering commitment to meeting the ever-changing needs of the Latinx community?
Mm-hmm.
What factors influence its growth and adaptation?
Yeah, this is a kind of cluster of questions.
Yeah.
Yeah.
It's a little bit more focused. The question is a little bit more focused on the medical side, but I will tell you this: for information technology here at La Clinica, we've done our best to change with the times. One of the very first things that we did in the early years was really take a look at the technology that existed for example, the technology that existed when I first came here. Very few people had exactly the same computer. There was different kinds of computers in the organization at that point in time, and they couldn't talk to each other. In fact, they couldn't share information between each other. So we began to introduce some structure to that. That later led on to policies and procedures and how do we do various things for the organization. But implementing this concept that there was going to be a standard for the organization, that we would stick with that, and then continuously upgrade that as time goes on, has been really critical, I think, to the success of the organization. So today we run PCs like this one that's right here. But back in those years, everyone had a different computer. They couldn't even communicate with one another. And that led to the second major change. Some years after I started working here at La Clinica, I installed the very first real connection between 2 different buildings, 2 different sites within the organization, and began to actually build the data network that is La Clinica today. But today we're involved in all the latest technology. We use cloud-based services where we are heavily connected to the internet. There is massive cyber security measures that are in place to make sure we're protecting the organization, and on and on and on. We could go on for hours also on that topic as to what's here, but we've needed to create that environment so that the mission of the organization can continue.
Yeah, and I know that is another part of the question, but you mentioned the earthquake, and I have in the back of my mind. I said, How was that part when there was the earthquake and?
I was in a small office that I had at the back of 1525 Fruitvale. And like today when we started, the first thing I did is I opened the windows. It's usually what I always do when I enter one of these rooms, is I always open the windows. And so that particular day I happened to be sitting at my desk and there was a window next to me, and I had clear vision through the parking lot of Fruitvale, the street, Fruitvale. I could see the street. I no longer remember what I was doing, but whatever I was doing, it had something to do with the organization. But my telephone rang, and it was my father. And my father never called me at work. He would call me at home, but he would never call me at work. And so I picked up the telephone, and I was just surprised. Dad, are you okay? Is Mom okay? I was asking him, why was he calling? And I was very happy that he had called me. Don't get me wrong, I was really happy that he had called me. But about 10 seconds into the conversation, the room starts to move. And so I have him in my ear, the room is moving, and I looked at Fruitvale, the street, and it is going up and down. You can see the wave of the earthquake in the street over and over and over again. And I told my father, Dad, I have to hang up. We're having an earthquake. I will call you back later. And he said, okay, mijo, God bless you, take care of yourself. And we hung up. When I hung up, I noticed that the bookcase, which was right on the other side of me, was falling. So I got up from my desk, and I held the bookcase back against the wall. And that's how we finished the earthquake.
Wow. The
power was out. Everything had gone out, and I could hear people screaming. I could see staff that were running into the parking lot, and out of the back corner of my ear, I could hear someone praying in Spanish, but quickly, quickly going through the Hail Marys, the Our Fathers. They were just praying as fast as they could. Well, my first reaction was to go quickly through the building and make sure everybody was out, because the building had moved so much I wasn't sure if it was safe, and I just wanted to get people out. So that was the very first things we did, is we tried to get people out of the buildings and start getting them home and close the doors and and just try to finish the day, because the power was out. About 5 minutes later, I found the woman who was praying. She was in one of the little buildings that was one of the little trailers that was behind 1525 in those years, and she was just praying. She had a rosary in her hands, and she was just like a statue, just praying as hard as she could. And I went up to her. I gave her a little hug. I told her it was okay. I told her to get her things, get in her car, and go home to her kids. And she did.
Wow.
That was the 1989 earthquake, the actual day of the earthquake. I don't remember exactly, but I think La Clinica may have been closed for 2 weeks after that, for a lot of reasons. But one of the reasons was that we couldn't get the replacement parts we needed for the refrigerator, half-size refrigerator computer. We couldn't get them fast enough. A couple of things had broken in it. One of the things that had broken in it was the hard drive. Today, if you look at a hard drive, there are these tiny little things today. But back in those years, they were the size of 2 shoe boxes. These big old machines, and this server had 2 of them in there, and one of the hard drives had completely failed, and the system just would not start.
Yeah.
I don't remember when power came back on. I don't remember those details anymore. I'm sure they're probably written down somewhere. But I remember that when power did come back up, I did go back to the office, and we tried to get this machine to run for hours. We couldn't get it to run. And finally we were able to diagnose what it was that was needed for the organization. But back in those years, as with everything, really the most important stuff was taking care of our staff, taking care of our patients, and making sure that people were safe. That was the first reaction, not just for me, but for a lot of us that day. We took care of each other, I think, is the important thing to say.
Yeah, absolutely. And what bring me to other question that I left and I didn't assess before as the COVID, that at your office have to, I know, no patient, but you weren't, you're surrounded. How do you take it?
So, again, it's probably another many-hour story.
My
And
goodness.
I will tell you, if you wish, I'm happy to talk with you again on any of these if you wish.
That's important because what I said is you had too much to say that probably we had to plan another encounter too.
Yeah, and I would be happy to do this again with you.
Thank you very much.
On anything you would like to talk about. But let me tell you just a little bit about the beginning of COVID. I have always been one of these people who is constantly aware of what's happening in the news, and I don't mean just with respect to technology, just everything. I was aware before that January that there was people that were getting sick in other parts of the world, and they didn't know really what was going on. During that period of time, La Clinica was focused, and I mean completely focused, on moving from the next-gen electronic health record system that I talked about a little bit earlier. We were moving from that to the new electronic health record system called Epic. And I can't begin to tell you the immense amount of details and planning and training and staff that needed to be hired and on, all this work that needed to be done in order to prepare the organization, prepare the data, prepare the software, and prepare for the move to this new EHR. It's something that just doesn't, it's not like installing a piece of software on your computer at home and then just start using it. The planning for this is massive. A lot of people at La Clinica don't know that I worked on the contracting for Epic years before we had even arrived at that particular point. So I had been involved in this for a number of years and was taking all the steps that we needed to take in order to get there. So by that January, people were really getting ill everywhere, and at some point the state of California, I guess it was the governor, right? Declares a pandemic, that people need to stay at home, all of that stuff happened. And we're I think a month or 2 months away from quote unquote going live on the new system. We had a lot of decisions to make. Were we going to stop? Were we going to try to finish them? What were we going to do? There was a lot of discussion that needed to happen. I had a lot of communication with a lot of different people. One of those people was certainly Jane. You mentioned you've spoken to Jane, and I recommended to Jane that we should find a way to just continue and get this finished. So we ended up working with Ocean, and Ocean changed their processes completely also because of us. And we pushed them very hard to figure out how to implement a new electronic health record system for an organization as large as La Clinica is, and how to do that work remotely. And it wasn't easy, but we were one of the first, in fact, I think we were the first organization in the United States to implement Epic remotely.
Let me see.
So the impact that COVID had was not just on that project, right? Certainly it was a huge impact on our community and on the healthcare that we were providing and how we provide that healthcare. And so technology needed to change overnight. And I had to figure out, how do I lead our team through all of those decision points that need to be made along the way? How do I keep La Clinica secure? How do I provide for the cybersecurity of these changes that need to be made overnight? And how do I keep this organization moving? There's a lot of thinking that need to happen behind the scenes. And I had to draw on all the years of my experience in technology to be able to be a servant leader through something like that. I'll give you one example. Before COVID, La Clinica had never run at a large scale testing and vaccine services from parking lots. How do you do that? How do you do that when there's no connectivity, or where your Verizon signal is so low that you can't get a good data connection? We had to get all of those kinds of things figured out behind the scenes so that our medical staff could do what they needed to do to help our patients. I have a lot of guys that are working back here that were here during those periods of time. And they completely understand what it takes to be able to pull something like that off, and to do it on nearly overnight.
Wow.
The massive challenges. One of these days I'm probably going to try to write a book about this, because it was just so many things that need to be considered, and I'm only telling you just a couple that are coming to my mind right now.
Yeah. But it's incredible. Today the life is impossible without electronic, without
Right.
digital world.
Right.
What could be happen for an institution like
Right.
Clinica, and suddenly you have to coordinate even telemedicine,
Right.
even all of this, and that's continued to be the question. How
Right.
was the installing of the telemedicine?
Right. Yeah. It's an intense discussion. I mean, I think one of the things for me is, with respect to this mission of providing healthcare to our community and to the most underserved in our community, we are required by law, both federal and state law, to provide that healthcare in a secure fashion. We have to respect privacy. We have to respect security. Those are the HIPAA regulations. And we have to worry, here in California, we have to worry about two of them. We're held by HIPAA law that's on the federal side, and we're held by HIPAA law in California. So, thankfully, some of the regulations where the restrictions were reduced somewhat, but there was a danger in that. If we signed a contract with some organization that could provide some kind of a technical service, but without the requirement on HIPAA, when the pandemic was over, if we were still using it, that was going to create a problem. So I made the decision that that we weren't going to go down those paths. We were only going to look for organizations that could respect HIPAA even during the COVID, and that placed La Clinica in a position much different from many of our sister organizations in the Bay Area. I think today, and even then, and even before then, this question around cybersecurity, it's critical, because we're taking care of the data for our community members who are the least able to provide for themselves for these things. And frankly, it's not their responsibility with respect to what I'm talking about. It's our responsibility to provide that.
Yeah.
But in the same way that we all have family, we all have family members that have passed away, and we all have things that we value greatly in our own families. I carry that same level of respect and honor, and whatever it is that's in one's soul around that kind of thing, for the data that belongs to our patients.
Yeah.
And so making sure that we're taking care of that in the most cyber secure ways, even during the beginning of a pandemic where everything is needing to change, is really paramount, and is really part of what we La Clinica need to do. And you'll never find that written anywhere.
Yeah.
You'll never find that in the media. but it's certainly there behind the scenes, because in much the same way that we respect and honor those treasures in our own families, these are treasures that belong to other people, and we need to do the same for that.
It's what I said. It's the story that is haven't been counted or tell.
Right.
You know, it's like many people told me, no, but it's because I am not a doctor. But doctors can no work all that they do without your department, and you know, and not only connected. You know, being doctor myself, I don't have the chart of the patient. Then how can I follow up? How can I know who is this? You know, if it's the first encounter with me, I have to elaborate that, and that is a register. It's a you know, the archive for this patient, and it's important. It's matter of life or death to have this. Well, thank you for that.
You're welcome.
But no for the answering of the questions, and for doing that, respecting HIPAA and
yeah,
all
it's important.
Yeah.
It's a highly important thing.
And the way that you put it, like if I want this respect for my family, I wanted to respect members of my of let's put it, patient or client of the clinic.
Yeah, it's our responsibility to protect the treasure that is the data that belongs to our patients.
Yeah, that's why, again, thank you for that.